morning. It's my honor to be discussing AI with such distinguished guests in the audience. The task that was given to me was to paint a broad picture of the lay of the land, opportunities, potential of AI in the healthcare industry. So it's going to be a very high-level, broad overview that I plan to share with you. Let me start with an anecdote. Last month, all the medical colleges around the country held their orientation programs for the incoming batch of MBBS students. At one such event, some of the parents were asked to come up and speak to the audience and share their thoughts. A father of an incoming student came up on stage, and I believe he was an IS officer, and here's what he said. He said, do all of you know what your jobs will look like 5 years from now? And this is what he said to the students that were coming in. Let's address the elephant in the room. Is AI a threat to the medical profession? Why would you even think that as a possibility? I'm sure all of you doctors in the last few years have been seeing patients that come with a lot of research that they have done on Google. And the conversations that you have around them, I'm assuming, are things that have made you think twice about this. But that's not all. Now it's no longer just research. Now you have apps that tell patients how they can potentially diagnose their own symptoms, maybe even make recommendations on what they could do to treat themselves. And to top it all, there are media announcements like this, where there's all these tech companies coming in and making claims about how their algorithms are better than humans. Is this something to worry about? I'll actually contrast this with a hypothetical picture. Have you ever had a semi-intelligent conversation with a machine? Is that even possible today? Think about yourselves as doctors. You can bring a smile on the face of a patient with just a few words, maybe a gesture, maybe a simple touch. Do you think machines are there yet? Obviously not. So this is confusing. On the one hand, there are machines that can do miracles, and then there's simple things that a human being can do that a machine still can't. So how do you make sense of all of this, and where does it leave us in terms of bringing AI into the healthcare profession? So for this, let's peel the onion a little bit and see if we can understand AI a little better. I'm sure all of you know by now that AI is nothing but algorithms that learn, algorithms that can be fed data to produce a predefined output. AI is not a single algorithm. It's a whole range of different algorithms. Most of the systems that you would have come across are systems that are designed for single purpose. They can do one thing and do one thing really, really well. Compare that with human beings. Human beings are not single-purpose machines. Human beings actually can do a variety of tasks. They may not necessarily be good at all of them, but they can do a bunch of different things. That's really what we call as general AI. General AI is still very much in the domain of academics and research, and I suggest we really leave that to the academicians and the researchers, and some of them are here today. Let them work on those problems. For now, I believe we should be focusing on narrow AI, at least for the healthcare industry. This is where I see the opportunities for us. Narrow AI, which is really a range of different algorithms that can solve very specific single-purpose problems, in many cases has reached an inflection point. It's reached a point where it's almost as good as, or in some cases even better than what humans can do. So the opportunity for us is to really look at AI algorithms as tools. These are, think of your medicine bag. This is another set of tools that you can add to your toolkit. Now, like I said, AI is a whole bunch of different algorithms. Where do you start looking? How do you start thinking about how these algorithms can help you? So I was looking for a framework, a mental model to help us think through all the different possibilities that AI can do for healthcare. Here's a simple one that I came across that I thought would be easy to share and learn from. And don't worry, you don't have to memorize all of this. I'm going to share with you specific examples of each one of them, and then also maybe connect the dots and try to show you how this could be potentially applicable in the healthcare domain. Let's start with the simplest one, recognition. I'm sure all of you are now familiar with this pattern of AI. This is where companies like Google and Facebook have become really good at identifying objects in a photograph. You may have also seen the recent announcement where Bangalore Airport says they're going to use facial recognition so you don't have to have boarding passes. So this is the pattern called recognition. And the obvious implication of this for the healthcare industry is in the medical imaging space, where you can look for abnormalities in your medical images. This is a fairly standard use case, but hasn't yet really become commercialized in a big way. What is the challenge with this? The challenge with this is not the technology, not the AI algorithms. The AI algorithms have proven to be really, really good. In many cases, even better than what a human radiologist can do. The challenge is, how do you integrate this into your radiology workflows? How do you have a very seamless collaboration between humans and technology to really deliver an experience where the radiologist sees this as a tool in their toolkit as against replacing them? In the interest of time, I'm going to keep moving on quickly to the 7 different types. So here's the second one. This is what we call as patterns and anomalies. How many of you have had a situation where your credit card company calls you after a transaction and asks you, was this really you that made this transaction? This is anomalies in your standard pattern of behavior. So banks have now become very good at using AI to catch something that's out of the ordinary, something that doesn't fit into your normal routine, into your normal pattern of things. Where would this be applicable in the healthcare industry? Whole bunch of areas. The healthcare industry is all about standard protocols. Protocols for how medication is given, protocols for procedures, protocols for how claims have to be submitted. All of these are excellent opportunities for us to identify anomalies, identify outliers, things that don't fit into a normal pattern of things. What's the challenge with bringing something like this to market? The challenge is data. How many healthcare providers actually capture the level of data that's needed to do something like this? So this is something I think we all should look at and see how can we get better at collecting data, because anything that you can do here either helps outcomes, which is great for patient and for doctors. It also helps with revenue leakage. So I think this is something that we should all pay attention to. We could have very quick impact from technologies in this space. Third one in my list is predictive analytics and decisions. I know this could make some of you nervous. Are we actually talking about machines making decisions? I would say yes, but they're for the better. An example of this in the real world is machines that are now embedded with sensors. These sensors collect a lot of data about the health of different components in the system. And that data is analyzed by AI algorithms to predict potential failure. Failure due to wear and tear, due to unexpected circumstances, and so on. Something similar could be applied in the healthcare industry. How many different touch points do healthcare providers have with their patients? And not all of them are directly with the doctors. In fact, very few of them are with the doctors. But at every one of these touch points, if you can actually collect data that helps you predict what the patient is going through, what the patient may potentially go through down the road, you could potentially take action and intervene in a more timely manner. Here's an example of a chatbot that could follow up with a patient that's recuperating. And when it detects symptoms that may be simple, that may sound really simple, but potential for harm, and it could intervene and actually make an appointment with the doctor for a follow-up, right? So this is an example of predictive analytics and decision-making. The challenge with this, however, is if you look at an overcrowded market like India, the hospital market, we really haven't done a good job of streamlining our touch points. The touch point between a provider and the patient is not as seamless and smooth as it needs to be. And without that, it's very hard to bring in algorithms like this. So really, you look at AI as a small component of an overall solution that you have to build. You really have to look at all of your touch points and figure out what do you need to do to deliver a great user experience for your patient. Moving on, conversation and human interaction. These apps are now slowly starting to get popular. These are apps that you potentially download on your phone when you travel abroad. They help you translate from one language to another. So obviously, when you don't speak the language, you use the app to convey what you want to convey to the other person in the conversation. Where would this be useful? Think of a scenario where a patient and a doctor are having a conversation. And I'm not even talking about translation here. Let's assume they're talking the same language. Imagine a device, an Alexa device or a Siri kind of application sitting on the doctor's desk that's listening in on the conversation. And from the conversation is able to extract bits of meaningful information and automatically populate your EMR. No keyboard, no writing on notepads, no smart pens, no nothing. It's listening in and automatically generating medical records for you. This is not fully there yet in terms of a completely workable solution yet. There's a lot of NLP technologies that need further development to get here. So in the meanwhile, the opportunity for us is to work together, the technologists and the medical community to work together to solve these problems. And during that time, solving that problem will mean doctors actually doing a bit more than just speaking to the patient. They'll have to make corrections to the records. They'll have to fill in the gaps, et cetera. Designing of the system in such a way that it doesn't really come in between the patient and the doctor during their interaction is important. So that's something to watch out for when we look at starting to try out technologies like this. Moving on, autonomous systems. Now here's where we get to the scary part. All of you know what this is, right? This is coming. How many of you would be willing to sit? Okay, a few hands going up. Still not a very comfortable thought, I believe. But there are 25 countries around the world that have already been certified for driverless cars. And what does it mean to be certified? It means testing facilities, legal frameworks, and so on and so forth. But let me quickly move on. I don't think any of us is ready for this yet, right? I certainly am not comfortable lying on an operating bed with a machine hovering over me. But you can look at simulations, training kind of examples. I'm going to move on quickly because I think in the interest of time I should. You all know what targeted advertising is. The application of this is precision medicine. And I don't think I need to explain to this audience what precision medicine is, but targeted recommendation technologies are useful here. And I'm going to leave you with just one piece of homework. The final pattern here is goal-driven systems. Sir already spoke about Deep Blue, the application that killed Gary Kasparov's strategy. I'm looking for you to come back with an opportunity where this is applicable. Homework for you. Thank you.